All right. Hey, crew. What is up? My name is Dr. Trissa Hutchinson. I'm an occupational therapist with the Institute of Clinical Excellence in the Older Adult Division. Welcome to the Modern Management of the Older Adult podcast. I am so excited to speak to you guys tonight about exercise in disguise and how to increase your patients' overall participation, specifically with those individuals who have dementia, are living with dementia, or those patients who just don't like to exercise. They, in your session, just don't want to participate. It's not their jam. And how do we increase and get those people moving and grooving again? So where this all came about and why I want to really talk and deep dive into this is I recently had some conversations, and it's very common to hear that, it's super frustrating for physiotherapists that we have that one patient who we just can't get them to do anything. There's no goal directed behavior by the patient. They just, the person, we go in, we try, but they just don't want to push hard, or they seem like they're always trying to chit chat and get distracted or try to get us off topic. And they're not motivated to participate in what we want them to do or what we know they need to do to get back on their feet or reach their goals. Now, I totally understand that, and it can be super frustrating to run into a patient who is acting this way or showing signs, symptoms, behaviors that are kind of in this like unmotivated or kind of delayed progress type of scenario. But I want to flip the script, and I want to kind of call out our profession, and I want us to look in the mirror at how we, as occupational therapists, as physical therapists, as any rehab professional, how can we dive in and change what we're doing to make the task, the intervention, more applicable for our patient? How can we take ownership of our session to increase participation and get off our high horse and make it meaningful, make it matter to our patient so that they are more likely to want to participate? So taking ownership of our patient's participation a little bit more. Okay. So in the older adult division, we dive into an awesome framework that Julie Reese set out in 2022. She talks about a framework for rehab professionals, specifically working with those who are living with dementia. And one of the principles that she deep dives into is this motor learning principle, and further talks about the benefit of having saliency to task and making sure that our interventions matter to our patients. And I could not agree more. When we talk about using intervention and exercise to help our patients, it's fantastic, right? We preach over and over that older adults are strong too. They need the intensity. They need to be doing the squats, doing the deadlifts, the overhead presses, the snatches, all of the things. They need all of those too, just like yourself and myself. However, if they do not understand what the point is, they're less likely to participate. They're less likely to care. Okay. So we need to make sure that we are connecting the dots for them. Connect the dots for them. Correlating an exercise to an occupation is very tough to comprehend. You and I may know that if I am doing a goblet squat for reps and I'm getting down and I'm using heavier weight and I'm progressively overloading, that might make sense in my mind, that I'm going to be able to get on and off the toilet easier. I'm going to be able to get in and out of the car a little bit more simple. Maybe when it comes over to the stairs, I've got no problem. I can get up, I can get down.